The problem with cigarettes is not the nicotine, it's the smoke. It's the inhalation of smoke that causes all the death and disease, and it's killing roughly 20,000 people a day globally. When we move to a non-combustion delivery system, something where you don't have to suck smoke deep into your lungs, we end up with a product that's massively less hazardous. So as the Royal College of Physicians has said in the UK, that e-cigarettes are likely to be at least 95% less hazardous than smoking cigarettes. What we need is risk proportionate regulation to say that the most hazardous products are the ones we should be trying to move people away from. And when you've got over 100 million smokers in India, over 300 million people who are using various forms of tobacco products, to ban the least hazardous product really condemns a lot of people to a premature death. Often there's a fear of new technology. And many academics have written about this, that the fear of anything new that outweighs what we know about the existing product. So we hold new products to a higher standard than the products they're meant to replace. Over 100 million people in India smoke cigarettes. Over 200 million are using other types of tobacco products. That's not going to go away anytime soon. So we have the ability to replace those with far less hazardous products. In a country like India, the sorts of products that exist right now would still be acceptable from a cost perspective for millions of smokers, just because there are so many smokers in India. But also because it's technology, it's electronics, the price falls. So, some people said 20 years ago that mobile phones might work in a place like England or Canada, but they'll never work in India because, people can't afford them. Well, look what happened. The price falls, the technology improves, and they're everywhere. And I think we could see the same here, that these products could be acceptable to virtually anyone who smokes, whether it's smoking cigarettes, smoking biddies. We could have products that replace the oral forms of tobacco that have carcinogens in them. The ability to transform the market is real. The technology has got us there. It's a matter of public health people and entrepreneurs seizing that initiative